In practice, in Chinese medicine, we know that certain colors open into the meridians. So obviously red would be for the heart. That makes sense. Yellow would be good for the bladder and kidney. So we may use yellows to encourage the flow of qi or energy through the kidneys, urine, bladder. The synchronicity wave system outputs a matrix of colors and light. Since the beginning of time, color and light has been used for healing. The National Institute of Health has published on PubMed much information about the use of color therapy and light. The patients that do land on our doorstep are the ones that have chronic fatigue, they've got Lyme disease, they've got MS, they've got brain traumas, they've got post-traumatic stress. My goal is to get this to our troops. Our troops are in need of this. These patients are the wounded warriors, the NFL football players, the average Joe who has had either an injury, post-traumatic stress, post-surgical sites, the Lyme disease patients, the MS patients, anything neurological where we're trying to communicate the brain to the nervous system and so forth. In the synchronicity wave system, we can treat multiple people. We can put 100 people in a room. We can run some of the generic programs that are just the colors and the matrices. We can test for specific programs to see which one is best tolerant, compatible, and which one resonates with that patient more. We've proven to them that they're feeling better, less stressed, their pain goes away, and that's huge. There's a chapter that we're seeing in Colorado of wounded warriors that are getting benefit. We're also looking to the NFL based on their post-traumatic, their post-concussions. We're seeing improvement there. Those are the kind of patients that are calling us going, we understand you have something that might be of benefit. And we have the Lyme disease patients that come in and they've tried everything, they can't take anything because they're too toxic, they're too tired, and we're seeing these patients get their energy back, and that's huge. We don't make medical claims with the use of the synchronicity wave system. What we've done is when patients ask us, does this cure this? Does it treat that? What experience have you had using it with patients? We commonly just tell the patients, why don't you sit in the system and tell us what it's doing for you? We'll put you in the system minimum 4 to 6 times to see what kind of response you're getting. If you're having issues that are not sleeping, not feeling well, your energy is low, it's been reported to us by many clinics and patients alike that are saying they have better energy, they're sleeping better, and they have a better sense of well-being. Being a doctor of Oriental medicine and studying an environmental illness, we know we can help patients where other modalities won't. So being a doctor now is more exciting than ever because we're not just dealing with sick patients that we seem to only get well a portion. We now have a technology that seems to give us more hope and vitality for the patient and ourselves.